Greetings, it's Dr. Lipi Roy. Welcome to my show, Health, Humor, and Harmony. This week, April 24th to the 30th, is World Immunization Week, which aims to highlight the collective action needed to promote the use of vaccines to protect people of all ages against disease. The World Health Organization, the CDC, and other health agencies and advocacy groups across the globe come together to raise awareness of the value of vaccines and immunization against potentially deadly infections, and to ensure that governments worldwide obtain the necessary guidance and technical support to implement high-quality immunization programs. The ultimate goal of World Immunization Week is for more people and their communities to be protected from vaccine-preventable diseases. This year's immunization campaign comes at a particularly critical time as the COVID-19 pandemic has disrupted disrupted access to so many essential preventive services, which I'll discuss later. As a result, millions of people are still missing out on life-saving procedures, imaging, and immunizations. The 2022 theme, quote, Long Life for All, or hashtag Vaccines for Life, aims to unify people around the fact that vaccines have made it possible for us to follow our dreams, protect our loved ones, and live a long and healthy life. A brief history of vaccines. In 1796, Edward Jenner, a doctor from England, noticed that milkmaids who got cowpox were protected from smallpox, which, by the way, is one of humankind's most deadliest infectious diseases, killing over 300 million people since year 1900 alone. Dr. Jenner then ran a series of experiments that led to the discovery of the smallpox vaccine. A massive global vaccination campaign over the next several decades put an end to this devastating disease. Many people consider smallpox eradication, the first disease ever eradicated, to be the biggest achievement in international public health. The reality is that vaccines are perhaps the most successful and cost-effective public health intervention and impactful scientific discovery ever, saving millions of lives across the globe. Parents can worry less about their children dying from harmful diseases because of vaccines. In the past 2 decades, over 1.1 billion children have been immunized, saving 4 to 5 million lives each year and helping to reduce child deaths by half. Today, we have vaccines against 28 human diseases, with several resulting in a 100% reduction in death from infections such as measles, mumps, polio, diphtheria, and rubella. Here are some immunizations that are recommended by population. First, mothers and infants. Many vaccines that protect mothers can also protect the fetus. For instance, neonatal tetanus is almost always fatal, but can be prevented when mothers are fully vaccinated before giving birth. Vaccinating babies against hepatitis B within 24 hours of birth, followed by 2 to 3 doses within 6 months, will prevent chronic hepatitis B, a disease, by the way, that kills over 800,000 people worldwide each year. Second population is children. Vaccination against 10 common diseases has saved approximately 69 million children between the years 2000 to 2019. Routine childhood vaccinations include mumps, measles, rubella, diphtheria, tetanus, polio, or DTP. There is sadly cause for concern. DTP vaccination was the lowest ever in 2020, likely due to the COVID-19 pandemic. Polio outbreaks in Malawi, Africa, are also a concern, and Afghanistan and Pakistan remain the only countries with endemic wild poliovirus type 1 transmission. A third group is teenagers and adolescents. Vaccines are the best way to prevent human papillomavirus or HPV infection, which can cause cervical, vaginal, vulvar, and anal cancers. The HPV vaccine, administered typically from age 11 to 26, is particularly life-saving in regions where cancer screening and treatment are not widely available. Bacterial meningitis is a deadly brain infection that strikes quickly, killing 250,000 people each year. It causes disruptive outbreaks, but it is preventable with vaccination. The CDC recommends the meningococcal vaccine at age 11 or 12 with a booster at age 16, as well as for adults at high risk for meningitis. And the other population is adults. They still need to get vaccines against diseases like influenza, COVID-19, pneumonia, and varicella, which is the virus that causes chickenpox, depending on your age, health conditions, and other factors. Talk to your doctor about which vaccines are recommended for you. Challenges, unfortunately, persist when it comes to protecting people from vaccine-preventable illnesses. In 2020, almost 23 million children did not receive routine vaccines, the highest number since 2009. This is unacceptable as it endangers not only the unvaccinated child, but vulnerable children and adults around them. Since COVID-19, a growing number of adults and children remain unvaccinated. So why aren't people receiving this simple and life-saving medication? There are several reasons. First, COVID-related lockdowns and other mitigation measures have disrupted access to basic medical care, including preventive services such as colonoscopies, mammograms, and immunizations. Second, access to vaccines varies country by country and even within countries, states, provinces, and counties. A year into the global COVID-19 vaccination campaign, approximately 11 billion vaccine doses have been administered, but the 50 least wealthiest countries have received only 8.2% of vaccines, even though they make up 20.6% of the world's population. Third, mistrust of the medical system. Despite studies showing decreased risk of COVID-19 related severe illness, hospitalization, and death after vaccination, Black and Hispanic individuals have been less likely than their white counterparts to get vaccinated. Racial and ethnic disparities are not surprising. 7 out of 10 Black Americans say they were treated unfairly by the healthcare system. The reality is that the United States has a long history of mistreating Black Americans, from gruesome experiments on enslaved people to forced sterilizations on Black women, and the infamous Tuskegee syphilis study that withheld treatment from hundreds of Black men. And fourth, aggressive anti-vaccine misinformation campaigns. The anti-vaccine movement was on the rise well before COVID-19. But now, through wild spread of vaccine misinformation on social media and other media outlets, an alarming number of children and teenagers are not getting vaccinated, putting them at risk for potentially deadly diseases. Many adults are also not getting vaccinated because of wild misinformation. Measles, for instance, was considered eradicated in the United States in the year 2000. Since January 2019 until April 1st, 2022, over 1,300 cases of measles were reported, mostly among unvaccinated individuals. So how can you get involved? You can join global campaigns organized by UNICEF. Take a photo, a selfie of yourself holding up the V sign or your vaccination card, protecting any private information. Share it on social media. Use hashtag vaccinated and tag at UNICEF. You can also join online and in-person campaigns. You can make donations and volunteer within your own community. Learn more from your own local public health agency, the WHO, the CDC, Gavi, the Vaccine Alliance, the Bill and Melinda Gates Foundation, and many other phenomenal public health organizations. Well, folks, that's all for today, but not before the joke of the day immunology theme. Why didn't the patient recover on Saturday or Sunday? She had a weakened immune system. Tune in this Friday, 3 o'clock Eastern, when I'll be discussing Autism Awareness Month. And be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.